Hello. Today I'll be talking about gonorrhea, and it's one of the STDs that we've been discussing in the last 2-3 days. So gonorrhea is one of those old sexually transmitted diseases that we've known about for decades, and it's used to be called CLEP. The cause of gonorrhea is a bacteria which is called Neisseria gonorrhea. It is sexually transmitted through anal, oral, vaginal sex. Can you get it without penetration? It is possible if there is a contact with a fluid, with genital fluid, to get it. However, you won't be able to get this infection from a towel or a toilet seat or just by touching something or a swimming pool. This is a sexually transmitted disease, and it's got to be sexual fluids and genital fluids involved into transmission of it. You can get COVID-19 from touching surface and touching your eyes or your nose. You will not get gonorrhea in this manner. Gonorrhea does not live on surfaces or outside of body for a very long time. How long does it take for the symptoms to appear? Anything from about 2 days to 30 days. Most people will have symptoms within 2 to 7 days. Interestingly, only about 20% of women develop symptoms, and most men will have symptoms when they have gonorrhea. So about 10% of men will have no symptoms, and 80% of women will have no symptoms whatsoever, but they will still be carriers and will be able to transmit this infection to their partners during sex. What are the symptoms? How do you know that you might have it? Well, vaginal discharge, greenish discharge, dark yellowish, and even blood-stained discharge is common. Women may have irregular bleeding or spotting. Burning and frequent urination is also one of the symptoms of gonorrhea. And if gonorrhea is left untreated, it can even lead to more significant issues such as pelvic inflammatory disease or PID, and it will be associated with abdominal pain, fevers, and a lot of discomfort. One can experience redness or swelling in the genital area, vagina, penis, testicles, and it will also be caused by gonorrhea. Gonorrhea causes eye infection as well, and in pregnancy it can be transmitted to the baby, and babies might have an eye infection going through the childbirth canal. Can one die from gonorrhea? It will be very unusual, because hopefully people will seek help before they are very sick. However, it is one of the STDs that can be transmitted from the genital organ into the blood and then into circulation, and lead to severe infections and even death. The worst case scenario is, of course, death, but it's not, as I said, it's not something that we would see in our modern times, because usually you would be sick and seek help of your doctor well before that. If gonorrhea is left untreated, however, for example, someone has no symptoms and they don't know they have it, it may lead to infertility, as well as ectopic pregnancy and pelvic inflammatory disease or PID. How do we test for gonorrhea? Similar to the way we test for chlamydia, and it's a swab that is taken either from urethra or from a cervix, vagina. In South Africa, this is not common, but in European countries, America, one even can do a home test where you do a swab yourself and send it to the lab and get your results in post. There is a blood test for gonorrhea, however, that's not reliable, same as with chlamydia. It will show antibodies, but it will not show actually whether you have infection now or not. A swab test for gonorrhea is very reliable, and it certainly gives you a result, whether it's positive or negative, and it's a result that is specific, sensitive, and you can rely on. How long does it take for gonorrhea to clear up once you receive treatment? Well, a couple of days if it's uncomplicated disease and the pelvic inflammatory disease is not part of this. However, if someone has PID and complicated gonorrhea, it takes longer. It takes a couple of weeks to clear. How do we treat gonorrhea? We use antibiotics. There is a couple of them that are available and work quite well for this disease. The resistance or ability of antibiotics to treat particular bacteria is changing, and for gonorrhea there is quite a lot of resistance to some of the antibiotics. However, we do still have a number like ceftriaxone injection or azithromycin tablets that treat gonorrhea quite effectively. Well, I think I've covered pretty much all I could on gonorrhea. I hope you have a good day and we'll chat tomorrow.